Hello, everyone. My name is Besu Alamu, and I'm here from the Census Bureau, ready to go through some papers in the Family Dynamics and Economic Uncertainty session. And this is the final session of the day, so thank you for being here. Today we have 3 papers, and we'll go according to program. So I'll give it over to Patrick. So I'll share my screen. Everything good?
Everyone hear me?
Yes.
Great. All right. Hello, my name is Patrick Landers, and I am an analyst in social policy for the Congressional Research Service, or CRS, which provides comprehensive research and analysis exclusively for Congress. Today, I'll be presenting a paper on the demographic and socioeconomic characteristics of non-resident parents. By non-resident, I'm referring to parents living apart from their children, rather than referring to parents' residency status in the United States or a specific state. Another term for non-resident parents that is sometimes used in the research literature is non-custodial parents. Next slide, please. So during today's presentation, I'll first provide some background on this study, including the potential relevance of this work for policymaking, an overview of the study's data and methodology, and then a brief review of the research limitations. Then I'll present some selected results from the paper. The complete set of results are available through CRS's public-facing website. Finally, since this is a research-focused conference, I'll close by briefly highlighting several ideas for future descriptive research that could be conducted using, in part, SIPP data. Next slide. And then this is the background for the study. So next slide, please. So research on non-resident parents is valuable for several reasons. First, federal policymakers and other stakeholders have expressed interest in non-resident parents out of concern for the well-being of these individuals. An analysis of the SIPP estimates that there were more than 9.7 million parents, or about 13% of all parents, who were not living with one or more of their children under the age of 21 in 2018. Second, stakeholders have also expressed interest in the well-being of the children who live apart from one or more of their parents. From the child perspective, the Census Bureau estimated that there were about 21.9 million children under age 21 who had a parent who lived outside their household in 2018, about 26% of all children. Like all parents, non-resident parents can make important emotional, time, financial, and other contributions to their children's lives. Next slide. Another reason non-resident parents may be of interest to federal policymakers and other stakeholders is because many of them are directly affected by one or more government policies or programs. For example, some non-resident parents are eligible for or receive need-tested benefits like Medicaid or SNAP. Some non-resident parents also receive services from fatherhood initiatives that seek to encourage greater family well-being. The Child Support Enforcement Program strives to ensure that children receive financial support from their parents, even when the children and parents live apart. Additionally, criminal justice policies, such as incarceration, affect a sizable number of non-resident parents. Next slide. This paper presents a descriptive study of the characteristics of non-resident parents. This analysis does not attempt to identify causal relationships between non-resident parenthood and other characteristics, such as education, as that would require more rigorous methodology than presented here. However, descriptive research is very important to Congress. Policymakers are often principally interested in the answers to basic questions like who, what, where, when, and to what extent. Unfortunately, relevant, up-to-date, and authoritative descriptive research is not always available from existing sources. The Congressional Research Service provides Congress with research and analysis, including original data analysis as necessary and appropriate. This report uses data from the SIPP. I reviewed a number of potential data sources on non-resident parents before selecting the SIPP. Relative to the alternative sources that are available, the SIPP had a number of advantages for this study, including that it identifies a broad population of non-resident parents in the United States, and that it collects such extensive information on those individuals, including their income and economic well-being, participation in government programs, their household composition, and other characteristics. This report's analysis relies solely on data from the first wave or year of the 2018 panel, which means it sidesteps potential concerns like sample attrition that can sometimes apply to later years in longitudinal surveys like the SIPP. Depending on the topic, the 2018 SIPP typically asked respondents for their information as of the time they were surveyed in 2018 or reflecting their status during the prior calendar year, 2017. Next slide, please. This analysis uses the SIPP survey definition of non-resident parent, in which a non-resident parent is a person 15 years or older who has biological, adopted, or stepchildren under age 21 who live elsewhere, i.e. they do not reside in the same household as their parent. Besides the non-resident parent pointer, the SIPP also includes a number of other measures with relevance for studying non-resident parenthood, including fertility history, the number of non-resident children, the level of contact between a non-resident parent and their youngest non-resident child, and the amount of child support, if any, paid by the non-resident parent during the reference period. In the case of the 2018 SIPP, the calendar year 2017. Next slide. While the SIPP has many advantages as a data source for the analysis in this report, it also has several limitations worth noting. First, the survey samples the civilian non-institutionalized population. As a result, the SIPP does not cover certain persons, including parents who are unsheltered or institutionalized. Accordingly, estimates produced using the SIPP most likely underestimate the total non-resident parent population of the United States. And additionally, the characteristics of the non-resident parents sampled by the SIPP may differ from the characteristics of the non-resident parent population excluded from the SIPP's sampling frame. Next, the SIPP and many other household surveys often underobserve persons from certain demographic groups along dimensions such as sex, race, ethnicity, and age, which may be particularly relevant to the study of non-resident parents, raising additional concerns about undercoverage and non-response bias. For example, prior research suggests that the SIPP, like other surveys, may in particular observe young people, Black and Hispanics, and males, all demographic groups that prior research suggests likely include many non-resident parents. Additionally, other research suggests that even when individuals participate in surveys, they often underreport their non-resident parent status. Respondents may also provide inaccurate information in response to other topics besides non-resident parenthood, such as income and public benefit receipt. The Census Bureau takes many steps to mitigate some of those issues, including the use of imputed responses and those efforts may not fully eliminate the potential for bias in SIPP-based estimates. Finally, the SIPP is also subject to sampling error. With limited exceptions, the comparisons presented in this report have been tested for statistical significance to reduce the risk of interpreting potential random sampling variation as real differences between groups. Next slide. And now some selected results from the underlying paper. Next slide, please. In 2018, the population of non-resident parents was fairly large in absolute terms, but accounted for a relatively small proportion, or 13%, of the total parent population. The 9.7 million non-resident parents included over 5.6 million parents who were living apart from all of their children under age 21, shown here in dark blue, and more than 4 million parents who had both non-resident and resident children, shown in light blue. Next slide. In comparison to parents who reported residing with each of their children under age 21 for a majority of nights, i.e. resident-only parents, non-resident parents showed some of the following characteristics. In the figure, characteristics of resident parents are displayed with the gray or left circles, while non-resident parents are presented by the blue or the rightmost circles. Non-resident parents includes parents with both non-resident and resident children. Non-resident parents were disproportionately male. For example, the uppermost result on this slide shows that while 43% of all resident-only parents were male, 75% of non-resident parents were male. Non-resident parents were also disproportionately non-Hispanic Black, though a majority were non-Hispanic White, and they reported less formal education, typically possessing a high school diploma or its equivalent, but no college degree as of 2018. Not shown here, but they were also more likely to be older than resident-only parents. While a majority of non-resident parents were married or divorced, a disproportionate share had never married. And while a majority of non-resident parents had had one childbearing union, a sizable share had had children with more than one partner, sometimes referred to as multiple partner fertility. Non-resident parents also reported less personal and family income than other parents. Looking at employment in particular, non-resident fathers were less likely to report working than resident-only fathers in 2017. The findings from the analysis of the 2018 SIPP generally aligned with prior research on the characteristics of non-resident parents. The paper underlying these slides reviews in more detail some of the likely explanations for the observed differences in characteristics between non-resident parents versus parents with only resident children. Next slide, please. The report also focused on the characteristics of low-income non-resident parents, a subpopulation that may be of particular interest to policymakers. For the purposes of the paper, low income is defined as having a family income that is less than 200% of the official poverty thresholds in 2017. More than 1/3 of non-resident parents reported having low income in 2017. Next slide. In this slide, I'm comparing the characteristics of low-income non-resident parents to the remainder of non-resident parents who reported a moderate or higher income in 2017. The moderate and higher income non-resident parents are displayed with yellow or left circles, while the characteristics of low-income non-resident parents are presented by the purple or rightmost circles. Relative to moderate and higher income non-resident parents, the low-income non-resident parents were more likely to be female. For example, while 1 in 5 moderate and higher income non-resident parents were female, more than 1/3 of low-income non-resident parents were female. Low-income non-resident parents were also more likely to be non-Hispanic Black and report less formal education. Not shown here, but they were also more likely to be older. Low-income non-resident parents were also more likely to have never married and report 2 or more childbearing unions. Not shown here, but they were also more likely to have more resident and non-resident children under the age of 21. Finally, low-income non-resident parents were less likely to have worked in 2017, particularly full-time year-round. And again, the findings from this analysis of the 2018 SIPP generally align with prior research on the characteristics of low-income non-resident parents. Next slide, please. In addition, whether a low-income parent receives various benefits appears to be affected by whether the parent has any resident children. So this slide presents data for 3 groups of low-income parents. The topmost, or dark purple bars, present the benefit receipt rates for low-income non-resident parents without any resident children. Those benefit receipt rates are lower than the receipt rates for the middle or light purple bars, representing low-income non-resident parents who reported also having resident children living with them, and the bottom or yellow bars, which represent low-income parents who reported only having resident children. This pattern makes sense in light of the fact that many need-tested programs often restrict eligibility by whether adults have qualifying relationships with resident children. Non-resident parents without any resident children may not be eligible for the same public benefits available to other parents, even though non-resident parents may provide significant financial support to these children, have shared legal custody to their children, or even have physical custody of their children for much of the time, notwithstanding an official custody agreement. Next slide. The SIPP also has data on parents' child support payments. A majority of non-resident parents reported paying child support in 2017, 5.4 million of them. The remaining 4.3 million, 44% of non-resident parents, did not report making child support payments in 2017. In some cases, parents who were not making payments may have had no formal or informal agreement to pay child support. In other cases, parents had obligations for which they were not making payments. The SIPP asks non-resident parents about their payments, not their child support obligations. The questions are framed around child support paid through any means, as opposed to just payments made through the government's child support enforcement program. The median non-resident parent paid a total of $696 annually in child support, while the mean payment of a parent was just under $3,500. If we narrow to just those non-resident parents who reported paying anything in child support, the median payment was $4,785, and the mean payment was $6,271. Next slide. The report also highlighted the child support payments of low-income non-resident parents. While low-income non-resident parents were less likely to pay child support, and their payments were also smaller in absolute terms, their payments were more likely to be large relative to their incomes than was the case for moderate and higher income non-resident parents. For example, about 1 in 5, or 0.7 million, of low-income non-resident parents reported paying child support that represented 35% more of their total personal income in 2017. Non-resident parents may find it difficult to pay child support obligations when those obligations consume a large percentage of their income, which is a major topic of interest to the child support policy community. Next slide. In the final section, I'm going to focus on future research opportunities, some of them involving the SIPP. Next slide, please. As noted in the study limitations, other available data sources suggest that while the SIPP successfully identifies many non-resident parents, it is likely underestimating the number of non-resident parents, even within the sampling frame, by perhaps up to several million parents. External researchers working with data from older SIPP panels before the 2014 redesign used other questions besides the non-resident parent pointer in those older panels in an effort to logically impute additional non-resident parents beyond those who directly self-identified as such on the relevant SIPP question. The redesigned SIPP already imputes non-resident parenthood in some instances. For example, 7% of persons categorized as non-resident parents in the 2018 SIPP had that status imputed for them, rather than being information directly reported by a survey respondent. It's possible that the imputations developed by outside researchers for older SIPP panels could be adapted, or new imputations could be developed to apply to the more recent SIPP panels and help identify additional likely non-resident parents. Second, when I started this project, I originally looked at the 2014 SIPP panel and multiple years of that panel. The 2018 National Academies report on the redesigned SIPP flagged that there was a substantial decline in response between waves 2 and 3 of the 2014 SIPP, which raised concerns about attrition bias and the adequacy of weights in compensating for that attrition. When I looked at non-resident parent and child support related variables in particular, I also noticed some large declines in the 2014 panel survey's annual seams. Those declines were larger than those reported by other data sources, including on some measures where I would place greater confidence on the alternative data sources, such as the administrative data that's available or the current population survey child support supplements data for custodial parents. I haven't done follow-up work with the more recent SIPP panels to gauge how the latest design of combining overlapping panels is faring on these issues for non-resident parents and child support in particular. Plus, we have to keep in mind how COVID affected many of those years, but it is certainly an issue that I think would need to be looked into further if researchers are doing work with SIPP beyond using just the 2018 panel wave. Next slide. Finally, the SIPP, as I've discussed, is just one of many potential data sources on non-resident parents. These data sources involve varying sample universes, concepts of non-resident parenthood or child support, the questionnaires, etc. By more exhaustively comparing the data, methodology, and results of these sources, researchers may be able to produce additional insights. For example, the CPS ASEC also identifies non-resident parents and child support paid, but I've generally found that it identifies smaller levels for both than the SIPP. The child support supplement of the CPS has a long track record of producing detailed data from the perspective of custodial parents, which in theory and ideally should be compatible to data from other sources regarding the perspective of non-resident parents, such as the data reported in this analysis from the SIPP. Another data source of potential use to researchers is the Urban Institute's TRIM3 micro-simulation model, which CRS regularly makes use of. This model builds upon CPS ASEC data and corrects for underreporting of certain public benefits, including child support received by TANF families, and it allows for the simulation of alternative policies which could affect both non-resident parents and custodial families. The Federal Office of Child Support Enforcement publishes administrative data on individuals and payments tied to the formal child support system, which can be a good comparison point for child support data in particular. Additionally, the National Survey of Family Growth collects detailed data on a number of family-related concerns. In recent years, the NSFG has sought to identify non-resident fathers between the ages of 15 and 49. Prior research comparing earlier panels of the SIPP and the National Survey of Family Growth found that the National Survey of Family Growth identified 1 million or more additional non-resident parents than the SIPP and the subpopulation for where the two surveys overlapped at the time. It might be worthwhile to update this comparative research using more recent data from both surveys. Additionally, an analysis from the Bureau of Justice Statistics of data from the 2016 survey of prison inmates estimated that there were 700,000 non-resident parents with a biological or adopted child age 17 or younger residing in a federal or state prison in 2016, a key group of non-resident parents that goes unmeasured by more traditional surveys of the non-institutionalized population. Insights on that subpopulation of institutionalized non-resident parents could be paired with data from the SIPP regarding the non-institutionalized non-resident parent population. At the bottom of the slide, I identify a few prior examples of researchers who have compared and contrasted multiple data sources on non-resident parents to try to extract additional insights beyond what may just be available through the SIPP alone. Next slide. That concludes my presentation for today. If you want to learn more about the research, feel free to contact me or access the full report, which is available online via the CRS's public-facing website. I'm grateful to the Census Bureau for the SIPP, as well as the opportunity to contribute to the conference, and I look forward to the panel discussion.
Thank you, Patrick. Next up, we have Shi Yang.
Hi everyone, good afternoon. Thank you for having me here. Okay, so the project that I'm going to talk about today is trying to identify how the bank credit expansion affects fertility using the SIPP data. Next slide. So this project was motivated by the data facts, which was well documented in the literature that we have this declining fertility rate, right? So look at this graph. We see the fertility rate has decreased from in 1991, which is 71 births per 1,000 women, to 2020, which is 55.8 births per 1,000 women, right? So we see this declining trend on this graph, and specifically, it seems there's two waves of trend. The first wave is kind of begins from 1990s and then goes through until 2000. And then the second decline happened after the Great Recession, right? Next slide, please. Now, when we put the housing price data, which is this dashed right line here, together with the fertility rate, as you can see, we got some interesting correlation here, right? So whenever we see the fertility decline, we see the housing price is actually going up, right? So this motivated me to ask the research question of whether there's a causality relationship between this rising housing price with the declining fertility. It is also been mentioned in the housing literature that those two waves that the housing price increase are mostly driven by the credit expansion. So that's why I'm coming to ask the question of whether the housing price caused by the credit expansion would lead to the decline in fertility. Next slide, please. So that's the my research question in this project. Basically, was trying to explain whether the rising housing price caused by credit expansion could explain household fertility decision. Next slide, please. So the key challenge or the empirical challenging here is if you want to identify the causal story, we have this endogeneity issue, right? So it is possible, like, for example, we have unobserved local market shocks, and we also have the reverse causality issue. For example, you can imagine in areas where fertility rate is relatively high, we have increase in population, this could increase the credit supply, or the banks in those areas are more likely to willing to provide more credits, which will also driving up the housing price, right? So it's hard to claim the causality story. Next slide, please. So what I'm trying to do in this project was trying to make use of the interstate banking deregulation, which happened between 1994 to 2005 as an exogenous shock to measure an exogenous credit expansion, and then see how the housing price as well as the fertility was going to respond to this exogenous credit expansion. And as I will going to talk about later, these types of expansion or the banking deregulation, they happened in different states in different time. So we have this across the state and across the time variation, which make it possible for me to adopt the difference in difference method to identify the causal result. Next slide, please. So just to give you a heads up of my results, so my main result is showing that the credit expansion will raise housing price, and also more importantly, will have a negative effect on fertility rate. So this kind of my results from this perspective will contribute to the literature, which was trying to explain the declining fertility. And most of the research currently were looking at the rising cost of housing and the limited research on rising cost of housing, while a lot of research was on the rising cost of childcare. So my project in this hopefully can contribute to this literature by showing some new evidence and also by adopting some relatively new identification strategy. Next slide, please. So a little bit of background about what is this banking deregulation. So the idea is, so historically, the interstate banking and branching is actually not allowed, right? So for example, if I'm a Texas bank, I'm not allowed to open a branch in California, right? But over the years, those kind of restriction has been relaxed. Particularly in 1994, the Interstate Banking and the Branching Efficiency Act has allowed have removed a lot of barriers of which allow banks to open branches in other states. Next slide, please. So as documented in the literature, I have been using one of the particular deregulation in this project, and the particular reason I choose this particular deregulation is I have tried the other policy changes or other types of deregulations. The results are not that significant. So that's why for this project now I focus on this particular type of deregulation, which talk about whether the statewide deposit cap can be larger than 30% or not, right? So the idea is if a state allow the statewide deposit cap to be larger than 30%, which means this state will allow the credit expansion to expand in a larger extent. So those types of deregulation happens between 1994 to 2005 and has a really large state variations. I do have some graphs showing the geographic variations in the table, in my paper. So next slide, please. Okay, so making use of those variations, I'm going to make use of this difference in difference method to try to identify the causal effect. And before I jump to the empirical method, I want to talk about my data a little bit first. So I'm trying to, the key outcome variables in this project is the fertility, right? So I measure fertility at 2 levels. At the first level is more aggregate level, which is the county year level, while the other is more individual level, where I use SIPP. So for the more aggregated fertility rates, I follow the literature, been using this natally birth data. So basically those are the data that you collect from the birth certificate. So you have the number of newborns for each county and for the between years between 1990 to 2002. And then we collect the total population for female counts in that particular county and particular year. Then we are able to calculate the county year level fertility rate. But there was a problem with this data that first is aggregated level, and also the information of whether the parents are homeowner or not are missing. And this kind of information are important in terms of we try to identify what is the mechanism behind this housing price effect and the credit expansion effect. So that's why I tend to the SIPP data. Next slide, please. So for the SIPP data, I used the from 1990 to 2001 panel. And particularly, my main outcome variable was calculated based on this topical module, the fertility history, right? So in this fertility history data, we are able to track the year of the birth for each female in the SIPP data. So based on this information, I constructed the fertility events outcomes, which will be used in as my one of the main outcome variables in my estimation. And also in SIPP, we have the asset and the liability module, which including the housing information, including housing wealth, housing equity, as well as when the house was purchased. So I can make use of this information to check whether this female, when the first children was born, whether this female is already a homeowner or not. Next slide, please. So this is the table where I summarize the information, the parents' information, females' information based on the natality sample as well as in SIPP sample. I think one thing that's worth checking here is by comparing the SIPP sample, the parents in SIPP and also or the mother in SIPP and the mothers in the birth certificate data, the characteristics are quite comparable. Next slide, please. So my main estimation model is the difference in difference model. So I care about the main effect as well as the dynamic effect. Well, all the models we have included the county or individual and the year fixed effect, depending on whether I'm using the county level data or the SIPP data. Next slide, please. So there's one thing I want to mention here is here this banking deregulation, they happened in a staggered way, which means we have a multiple treatment group with different treatment time. And there's a large literature recently have pointed out that when we have a policy change in this types of setting, there might be a bias with the standard two-way fixed effect, the difference in difference, because we are actually treating some of those early treated states as a control group. So that may cause a bias. So that's why I have also adopted this Conway-Santana method, this CSDID method to deal with this bias. Next slide, please. So this is my main results. This is for the county level fertility rate, and for the black dot we have the fertility. We have the results for the CSDID, and for the right dot we have the results for the two-way fixed effect. And as you can see, even though the pre-trend, there's some difference in terms of pre-trend, but in terms of the post results, they are quite consistent, and both showing that when states, the banking has been, interstate banking have been deregulated in that state, the fertility, county level fertility will go down. Next slide, please. And then I have done some robustness check to make sure my results are robust. So the first figure here, I have been adding some time varying control variables. the second figure I exclude those not yet treated as a control sample. And in the third panel here, third figure here, I exclude California and Texas just to make sure my results are not driven by those large states. And finally, I have excluded other deregulation which happened at the same time. And of course, the different regression models, I find quite similar results. When states interstate banking have been deregulated in the states, we see fertility go down. Next, please. And then then I start to look at the SIPP data, and they have been showing similar results here. So as we can see, the fertility rates have been decreasing after the interstate banking have been deregulated. Next slide, please. And here I have done the similar robustness check, but using the SIPP individual level fertility outcome, and the results are also quite robust across the different regressions. Next slide, please. So next, I have, because the SIPP has some ownership variables compared with the county level fertility outcome. So I'm able to conduct some empirical test in order to figure out what is the mechanism behind this negative fertility rate. So here I've done two tests. The first one is I directly test what is the relationship between banking deregulation and housing price, right? So if we want to have the housing price, the rising housing price as the driving force behind the negative fertility rate, the declining fertility rate, we want to check whether banking deregulation indeed have increased housing price. In test 2, I look at how the effect of banking deregulation affect the fertility rate on owners as well as on renters. The idea is for owners, they are able to have a housing wealth effect, which may so for them, the negative fertility effect might be small, while for renter, rising housing price, meaning a rising housing cost for them, which could largely reduce their fertility rate. Next slide, please. So this is what I have for the housing price, and quite consistent with the literature. We find banking deregulation has led to a persistent increase in housing price. Next slide, please. And here, when we are decompose it to owner and the renter, we can see here for the orange line, this is for the renter, and for the blue line, we have the owner. And the ownership decision, the ownership status, I have been defined it in 1990, which is at the beginning of my sample period. So so for this ownership status, this is not exogenous because they are already determined before the fertility decision have been made. And consistent with my expectation, we see most of the negative effect was concentrated among owners, but not among renters, which suggests that the potential mechanism of this negative fertility result could be banking deregulation leads to a rising housing cost, which have increased the cost of child care or the living cost for having the children, which will decrease the fertility rate. Next slide, please. So to summarize, in this paper, I have identified or estimated the credit expansion caused by banking deregulation, which will lead to a negative effect on the fertility rate. And the results are consistent at the aggregate level as well as at the individual level. And I have suggestive evidence showing that the rising housing cost is the main driving force. And the next step, I would like to try more direct test in terms of the mechanism to look at the child care cost, and as well as there's some, I know I learned from, today's conference, there's a lot of variables regarding child care in SIPP. So that's something that I would like to try for the next step. So that's all. And I'm looking forward to the comments. Thank you.
Next up, we have Kristen Perkins, who will be sharing her work on shared households as a safety net for older adults.
Great. Thanks everyone for sticking around for the last presentation of the conference. My name is Kristen Perkins. I'm an assistant professor of sociology at Georgetown University, and I'm presenting joint work with Hope Harvey of the University of Kentucky. Hope's here today, so feel free to direct all your toughest questions right to her. This is a new project for us, and today's the first time that we're presenting it. So we really appreciate the invitation to present to an audience who knows our data really well, and we look forward to your suggestions for how to further develop this paper. Next slide, please. So our goal in this paper is to examine the extent to which shared households provide a stable financial safety net for older adults. So first, we define shared households as those that include any adult besides the householder and householder's romantic partner. So for example, an older adult living with an adult child, a sibling, an adult nephew or niece, or a roommate lives in a shared household. An older adult living with a spouse or cohabiting partner alone is not living in a shared household. But if an older adult lives with a romantic partner and another adult, that is considered a shared household. So a growing literature documents the importance of sharing housing with extended family or non-kin as a private safety net for families. And one reason individuals live in shared households may be to realize financial savings from sharing housing expenses. Caregiving needs may be another factor that motivate individuals to live in shared households. We are motivated to study shared households among older adults for a couple of reasons. The first is that a large share of older adults, so those over age 65, experience housing cost burdens. In 2017, 10 million older adults households were cost burdened. Older adults who are burdened by housing costs spend less on other necessities like healthcare and food. And the housing affordability crisis in the United States poses challenges for households of all ages, but older adults are particularly vulnerable. And we heard about this yesterday in Showman Shamsuddin's presentation. So we know from recent work that 20% of older adults live in intergenerational shared households. And this means that they live with at least one adult relative of another generation. This share is even higher among Black, Hispanic, and Asian older adults. 27% of Black, 40% of Hispanic, and 40% of Asian adults ages 65 to 79 live in an intergenerational household. So shared households are a common arrangement for older adults and potentially an important safety net. And this background sets the stage for our research questions. Next slide. So the first is, what share of older adults live in shared households and what type of shared households do they live in? Much of the prior research on shared households focuses on families with children or young adults intergenerational households, and we are instead making older adults our focal household members. A growing literature focuses on the rising number of intergenerational households formed by parents and their adult children, but we know far less about older adults residing with other extended family and non-relatives. So here we're taking an inclusive approach to shared households, expanding the scope to include shared households formed with children and parents, but also extended family and non-relatives. Next slide. Our second research question explicitly considers resources in shared households. Do older adults in shared households contribute financially to housing, and how much do they spend on housing? So we're examining how rent or mortgage and utility costs are shared and provide insight into one tangible way that older adults may benefit from or be disadvantaged by sharing households. Research on intergenerational households finds that the older generation is typically the benefactor in these arrangements, but this research rarely observes the actual flow of resources. And studying housing costs directly is an important innovation because Income in shared households is rarely pooled, and having sufficient income doesn't guarantee that the household members are going to contribute to household costs. Next slide. Our third research question incorporates householder status and disability status. How do contributions toward shared housing vary depending on whether the older adult is the householder or living in someone else's home and whether they have a disability? So in shared households, the lease or mortgage holder is often assumed to be providing support, but older adults with high home ownership rates and fixed incomes may receive help paying for housing costs even when they're the householder. And then individuals who have a disability are more likely to live in shared households than those without disabilities. And because older adults with disabilities may have greater care needs, we also consider whether the financial safety net function varies by disability status. Next slide. So like all the other presentations we've heard, we're using the survey of income and program participation, and we're drawing from the 2014 through the 2021 panels. And for us, the SIPP has several key advantages to support this analysis. First, it includes a full household roster and is one of the few nationally representative longitudinal surveys to identify the lease or mortgage holder of the household. Second is that the SIPP includes individual level measures of source of income and housing payments. So we can identify income sources for all the individuals and which household member is paying for basic utilities and rent. The panel design of the SIPP will enable analysis of changes in household contributions and household composition over time. This is one of our next steps as we develop the paper. So we don't yet have longitudinal results to share. But today's results are going to provide a snapshot of shared household prevalence and housing costs. And our analyses are based on 33,410 adults ages 65 or over. We're capturing household composition and contributions towards housing costs in month 12 of the first wave of each of these 5 panels. Next slide. So in the next few slides, I'm going to walk you through our process for identifying household types. As I said on the prior slide, we're starting with all households containing an adult age 65 or over in December of the first wave of each panel. And we're using this month of data because the SIPP asks about individuals' contributions to housing costs in December of the reference year. So the first step is to determine whether each older adult in the sample is living in a shared household or a non-shared household. And we use the household relationship matrix and relation to household head variables to examine relationships between each older adult in the sample and their household members. So if the older adult lives alone or with a romantic partner, whether they're married or cohabiting, they're identified as living in a non-shared household. If the household contains an additional adult who's not a romantic partner, we determine that that older adult lives in a shared household. So we've got shared and non-shared. And then among older adults in shared households, the next step is shown here on the slide, determining whether the focal adult is the older adult is the householder or the host, or whether the focal older adult is living in someone else's home as a guest. So if the older adult is the reference person, meaning that they're the lease or mortgage holder, we determine that that older adult is the host. And if the focal adult is not the reference person, that is, they're not the householder or the householder's romantic partner, we determine that that older adult is a guest in someone else's home. Next slide. So once we've identified hosts from guests, we are further disaggregating the household types based on the relationship between the older adult and other adult household members. So intergenerational hosts, sort of the third line down, are the lease or mortgage holders who are hosting their parents or their adult children in their homes. Grandchild hosts are hosting their adult grandchildren, but not their children. So these are skipped generation homes. Other relative hosts are hosting adult nieces or nephews, siblings, or other extended family members. And finally, non-relative hosts are hosting adults who are not related to them. Hosts could be hosting multiple adults who fall into different categories, and we're categorizing them into mutually exclusive household types by prioritizing relationships based on the presumed closeness of the relationship in this order here, following previous research. So that's all on hosts. We're taking the same approach with guests, but it's a bit simpler because we're only focusing on the guest relationship to the host or the host romantic partner. So intergenerational guests are living in the homes of their parents or adult children. Grandchild guests are living in the homes of their adult grandchildren without their adult children. Other relative guests are living in the homes of adult nieces or nephews, siblings, or other extended kin. And non-relative guests are living in the homes of people who aren't related to them. Some of these categories get pretty small, even with a big sample, so we're limited in what we can say about some of the very specific categories. Next slide. So now that I've introduced our household categories, here are the results answering our first research question on the share of older adults living in shared households and the type of households in which they live. I'm going to walk out these results in the same order as I introduce the household categories. So first, 22% of older adults overall live in a shared household, leaving 78% of older adults who live alone or with a romantic partner. Next slide. Under shared household, the next level of disaggregation is host and guest. And so we see that 15% of older adults are hosts. They are the lease or mortgage holder and host other adults in their homes, leaving 6% of older adults are as guests sharing others' homes. So they live in a shared household and are not the lease or mortgage holder or the romantic partner of the lease or mortgage holder. Next slide. Now the slides are getting a little bit busier, but I'll walk you through these results. So the first column shows the proportion of all older adults in each mutually exclusive category. And the second and third columns of proportions are within the host and guest categories. So we see that 12% of older adults overall are intergenerational hosts, and 77% of hosts are intergenerational, meaning they host a parent or adult child. If we then jump down to guests, 5% of older adults are intergenerational guests, and 3/4 or 75% of guests live in their parents' or adult child's home. So as you can see from this slide, intergenerational households are the most common shared household configuration among hosts and guests, with less than 1% of older adults in each of the other categories. After the intergenerational categories, the next most common type of shared household among hosts is hosting an adult grandchild, which is 9% of hosts. And among guests, the next most common type is being a guest in an other relative's home, 16% of guests. Next slide. So this slide presents select characteristics of our sample separately by shared household status. Older adults in non-shared households are in column 1, older adults who are hosts in column 2, and older adults who are guests in column 3. And to quickly summarize, bigger shares of both hosts and guests are Hispanic, Asian, or Black compared with older adults in non-shared households. Smaller shares of hosts and guests were born in the United States compared with older adults in non-shared households. Smaller shares of older adults in shared households have education beyond high school. Smaller shares of older adults in shared households are married or cohabiting. And then finally, larger shares of guests in particular have at least one disability. Next slide. We use the SIPP variables that identify the household members who paid for utilities and or mortgage or rent and the amount that they paid to examine the association between living in a shared household and 4 different measures of housing costs. The first measure is a binary indicator of whether the older adult pays for anything for housing. The second is a continuous measure of the amount of money the older adult spent that month on housing. The third measure incorporates the older adult's income and is a measure of the proportion of income spent on housing that month, ranging from 0 to 1. We top code this measure at 1 since some individuals report paying more for housing than they report in income. And then our fourth measure is a binary indicator of whether the older adult spends more than 30% of this month's income on housing, capturing the conventional measure of housing cost burden. So I'm going to show you results for the pays for housing, amount paid, and cost burden indicator today. Next slide. So on the following slides, I'm going to show you predicted values from OLS and Logit regression models estimating the association between sharing a household and 3 housing cost outcomes. But first, here are the covariates that we include in the model. I already introduced some of them in discussing the descriptive statistics. So in addition to the indicators for race, nativity, educational attainment, cohabiting, married, and disability on the left, we also control for the variables in the right-hand column. So that's age, an indicator for female, whether the older adult receives Social Security benefits, their employment status, and inverse hyperbolic sine transformations of income and net worth. There are other covariates we'd like to include. I'm going to return to this when I discuss next steps, and we hope you can all make suggestions. Next slide. This slide shows the predicted probability of paying anything for housing in December of wave 1 of the panel among older adults in non-shared and shared households, controlling for the covariates on the prior slide. Older adults in non-shared households have a predicted probability of paying for housing of 0.81, compared with 0.59 among older adults in shared households. So this suggests that living in a shared household has financial benefits, as those who share homes have a lower predicted probability of paying for housing. Next slide. So here the two left-hand bars remain the same, but I'm adding predicted probability of paying for housing when we disaggregate into different types of shared households. The lighter blue bars here mean that these categories are not significantly different from non-shared households. And this slide reveals that the real difference in paying for housing is between hosts and guests. Hosts of non-relatives have a lower predicted probability of paying at 0.7 than non-shared households. But the other two host categories aren't significantly different from non-shared households. And guests of all types have dramatically lower predicted probabilities of paying for housing, less than 0.1, compared with older adults in non-shared households. Next slide. We observed the same pattern in predicted values from OLS models predicting the amount of money spent on housing in December of wave 1, with shared household status controlling for the same covariates. So older adults in non-shared households are predicted to spend $696 a month, compared with $600 among older adults in shared households. Next slide. But again, the real distinction here is between hosts and guests. None of the host categories are significantly different from non-shared households, whereas across categories, the guests are predicted to spend less than $100 a month on housing. Next slide. The third outcome that I'm presenting today is predicted probability of being housing cost burdened, so spending 30% or more of monthly income on housing that month. And we predict these probabilities based on a logit model with the same covariates as before. And again, we're observing the same pattern. The predicted probability of being cost burdened is 0.3 among older adults in non-shared households and 0.22 among older adults in shared households. Next slide. When we disaggregate by type of shared household, hosts of intergenerational household and hosts of other relatives have higher predicted probabilities of housing cost burden compared with older adults in non-shared households. And then guests have dramatically lower predicted probabilities of housing cost burdens that are all below 0.05. Next slide. So our third research question asked if contributions towards cost in shared housing vary depending on whether the older adult has a disability. These results show the amount of money older adults in the various categories are predicted to spend on housing based on an OLS model that includes interaction terms between living in a shared household and having a disability. We don't see much variation in the predicted values. They're all in the $600 to $700 range. And these models didn't return any significant interactions. So suggesting that disability status doesn't significantly change the association between living in a shared household and housing costs. Next slide. So to wrap up, I'm returning to our three research questions. We estimate that 22% of older adults live in shared households and that most of these shared households involve intergenerational relationships. Next. Do older adults in shared households contribute to housing costs? When we compare all older adults in shared households to older adults in non-shared households, we find that those in shared households have lower predicted probability of paying for housing and being cost burdened and are predicted to spend fewer dollars on housing expenses. Next slide. And then finally, how do contributions towards housing vary based on the type of shared household and other older adults' disability status? We don't find significant interaction with disability status, and we conclude that financial benefits of shared housing accrue primarily to guests. The predicted differences between guests and older adults in non-shared households were dramatic, whereas the differences between hosts and older adults in non-shared households were smaller and less consistently significant. Next slide. So we have plans to further develop this paper in a few directions. First, we want to integrate additional waves of each panel as appropriate to examine the stability of shared household members' contributions towards housing costs. Second, we intend to add analyses of heterogeneity by race, ethnicity, and by income source, especially Social Security. And we were sort of surprised by the relative consistency in estimates within different types of host and guest arrangements. So we may end up collapsing these categories to enable analyses along different dimensions of heterogeneity. Third, we want to expand our set of covariates. So receipt of subsidized housing is one covariate at the top of our list, but we'd like to hear from you what others we should consider. So thank you very much for your attention, and we look forward to your comments.
All right, thank you. Thank you everyone for presenting. Next up, we have our discussion. I'll give it over to Brittany to lead us off.
Good afternoon. Can you confirm that you can hear me okay?
Yes.
Okay, thank you so much. And I just want to say thank you so much to everyone who presented, especially in this session, for sharing your work with us, as well as giving us a chance to kind of hear what you're doing, how you're utilizing SIPP, and then giving us an opportunity to provide feedback. So as Basu mentioned, my name is Brittany King, and I am a survey statistician in the Fertility and Family Research Branch here at the Census. And so first, I'm going to speak with you about Patrick's research. So a few minutes ago, Patrick shared the research that he has been working on based upon a published report, which you are able to find online, and I recommend that you do if you are interested. This research includes information on parents kind of generally. However, there is a specific focus on non-resident parents. As Patrick mentioned, it's those who are not living with children under the age of 21. And although the focus is on non-resident parents, Patrick provided what I believe is very important context throughout the report via comparisons to resident parents, as well as further splitting up the groups of parents into three categories: non-resident parents, parents who live with resident children and who have non-resident children, as well as the parents who only reside with their children. I have to say, one of my favorite aspects of Patrick's work, especially as it's related to the SIPP, is the use of his key variable, the non-resident children under the age of 21. SIPP is well known for its household relationship question. For those who are unfamiliar, it is the variable that indicates the relationship to the householder of all other individuals in the household at interview month. So for example, if I'm the household, it tells you that perhaps my mother is living with me or my sister is living with me. And we also have a monthly relationship variable, which indicates how all individuals in the household are related to each other or not related to each other each month that they are present in the household. So it wouldn't just tell you that I am related to my mother, but it would also indicate how my mother and my sister are related to each other. And so I think that SIPP has this perception of being a really rich resource for household information. But as Patrick has clearly shown, it has a lot of unique and interesting variables that provide information on family relationships that exist beyond the household. And in this way, I think that Patrick is leveraging SIPP data in a very important and unique way. In regards to what I think might be worth looking into for future research or things that might be worth just pursuing pursuing in future research, in Patrick's presentation, he showed us that non-resident parents are disproportionately men, whereas resident-only parents tend to be somewhat more equal, about 43% men, 57% women. This makes sense, as we know, at least historically, that among opposite-sex couples, women tend to receive custody of their children. And so I think there's reason to believe that the non-resident parents who are women are not only different than their resident-only counterparts, but that they are also different from the men who are non-resident parents. Moreover, we know that there are educational differences in professions and associated earning potentials among women and men. And so I think there is a reason to believe that who can contribute and how much they can contribute to child support may also vary among men and women. To that end, including analyses where you look at men and women separately, I think could add an important insight into your findings, as well as potentially inform future policy proposals and/or decisions. Additionally, I don't believe you mentioned it in the slides that you presented, but in your full report, you include a breakdown of non-resident parents and parents by age, education, and employment status. And in those findings, readers can see that a non-trivial amount of the sample is between the ages of 15 and 29. About half of non-resident parents have a high school degree or less, as well as there being a significant percent of non-resident parents who did not work in the reference year. In thinking about why individuals might not work beyond health-related concerns or disability, I thought perhaps they could be enrolled in school, whether that be college or vocational school, and including a variable about school enrollment or currently enrolled in school could provide important context into these parents either trying to potentially better themselves, increase their earning potential, or increase resources that they would then be able to contribute to their non-resident children in the future. And then going back to health and disability, just for a second, in the report, Patrick, you mentioned that some of the non-resident parents who do not work, I believe it was 41%, said it was because of chronic health condition or a disability. And so in terms of thinking and trying to better understand how best to help these parents or how to best understand how these parents are able to help their children, looking at the number of disabilities that these parents are reporting could lend additional insight into their needs and how government programs could help them. Also in the full report, you include some analyses of family income, which made me curious about who might be contributing to family income and how many people might be contributing. And so I think that perhaps looking into family size or even maybe giving some demographics about who is included in the family could be important. There's also variables such as household size and or household income that might be worth your time, especially among those non-resident parents. These variables could help give additional context into the financial and social circumstances of these parents' living arrangements. In a similar vein, while you include information on current marital status of these parents, another thing that may be interesting to look at would be whether or not they are living with a spouse or with a cohabiting partner, just in terms of really trying to contextualize these individuals in their lives, as well as their own social and financial resources to then help understand how much they can then contribute to their children, whether they be the non-resident children they're living with or the resident children that they're living with or the non-resident children that they're living with. I have to say, overall, I really enjoyed reading your report. I appreciate how thorough you were, as well as how comprehensible this report is. I think you did a great job of really setting up the reader to understand the comparisons between non-resident parents, resident parents, and then taking it that step further where you split up the parents into those 3 separate groups. I know I previously mentioned a couple of variables that I think could be very helpful. So hopefully you will find them helpful as well. And then in regards to big picture, I think it's somewhat obvious you are writing reports that Congress use, so you are having a direct impact kind of on overall what our policies are and influencing how policy decisions are made, which I think is truly incredible. So thank you again for sharing your work with us. I really appreciate it. I appreciate the chance to read it and provide this feedback. Please let me know if you have any questions or feedback to anything that I said. Thank you.
All right, thank you, Brittany. Next, we will have George Hayward discuss Shi Yang's paper, which was presented second in our session. George.
Hello, can everyone hear me okay? All right, I will.
Yes.
I will assume yes. Perfect. Thank you so much. Thank you for having me at this conference, giving me the opportunity to be a discussant. And thank you very much to Dr. Yang for this paper, which I really enjoyed reading. For folks who may have joined late, this paper is called More Credit, Fewer Babies, Bank Credit Expansion, House Price, and Fertility. So a very fascinating topic. And the way I've organized this discussion, I'll give a few words, just a general overview, a little recap of the paper for people who may have missed it, and then briefly talk about the data, since that's what connects us all here at this conference. And then I mainly just have 2 suggestions and minor critiques for the paper and the work going forward. All right, well, overall, I think the paper was very clear, it was very persuasive, and it had some of the best graphs and figures I've seen in a paper in a long time. So kudos to you, Dr. Yang, for some of the graphics you had in this paper. The basic idea is that banking deregulation, which took place after the Interstate Banking and Branching Efficiency Act of 1994, allowed states to relax banking restrictions along these 4 dimensions, and the paper goes into them in a bit more detail. Now, some states had deregulated prior to 1996, but 1996 is the focal year in the paper in which there is a period beforehand where states had not yet deregulated their banks. And then there's the post period after 1996, which is important throughout the paper. And because this happened in a staggered way across states, states began to deregulate in 1996 and they deregulated at different times. We have a bit of a natural experiment to see if the fertility rates changed in the treated states or the states that deregulated versus the states that did not deregulate the banks. I think the paper is grounded very well theoretically. In the literature review, there's a nice discussion of the different mechanisms through which banking deregulation could affect fertility, because you may well be thinking, how could banking deregulation possibly affect fertility? And you wouldn't be alone in that, because I also was unsure at first. But there are 3 different theories put forward in the paper. One is through what's called a liquidity channel. So people would have more access to credit and therefore sort of more disposable resources for which, if they decide to have kids, they could maybe pull on more resources pretty easily. Then there's a substitution channel, which is the idea that if housing prices go up, it makes the trade-off to having kids a little bit greater. So fertility or demand for children would go down if housing costs go up. That's called the substitution channel. And then there's this housing wealth channel where if you already own a house and housing prices go up, hey, that's not too bad. You have more equity. You might think that you might as well go ahead and have some more kids. Things are going pretty well financially. And so 2 of those might have a positive effect on fertility, but the substitution channel might have a negative effect. Housing prices go up. Trade-off to having kids is too great. People delay or no longer have kids. And that was the key finding here, that banking regulation, debanking deregulation affects individual fertility primarily through that substitution effect, and particularly for younger renters. And that is, as banking deregulation increases, it causes house prices to rise, and with higher housing costs, it decreases the willingness of renters to have children. As far as data sources go, I won't go into all of them, but there were 5 different sources, only one of which was the SIPP. And Dr. Yang, I think you did a great job of incorporating county level fertility rates. There's a measure of undevelopable land that was incorporated to see if in certain markets, if there's not a lot of room to build new houses, that might have a bigger effect on housing costs. But as far as the SIPP data go, the 1990 to 2001 panels were used. And this was really important because you have information on whether or not people are renting their homes or buying their homes, which is really critical to these analyses. And Dr. Yang created a sample of individual fertility events. We also have the age of females, which is important because we know that fertility happens within a certain window of time and in the life course. Now, one of the limitations, I think, may have been that the home ownership measure in the SIPP was used only in 1990. It was a binary indicator on whether or not someone owned a home in 1990. And the same binary indicator was used for whether or not females were above or below age 30 in 1990. Now, I'm not sure from the paper if there was a reason that you had to have a binary indicator only in year 1990, but I was curious because if a female is under 30, let's say 29, 1990, but the banking deregulation doesn't happen for another 6 years, 7 years, 8 years in some states, now all of a sudden she's in her mid to upper 30s before we could even expect an effect of banking deregulation. So if age of the female is able to be a time varying covariate in this analysis, I think it would be a little bit stronger. Same with the home ownership. There's a big gap between when that measure is taken in 1990 and when we even would expect an effect of banking deregulation, which is now 6, 7, 8 years later. And one other minor thought about the SIPP data is that only first birth was used in these analyses, but somebody could have had a first birth, right? Sorry, my 2-year-old's looking through the window at me. Someone could have had their first birth prior to 1990, and then they wouldn't have had a fertility event in the sample. And I think that incorporating all the births a woman has in her life would be important for this kind of analyses, because we also might expect some differences by parity, especially for renters and owners. There might be a big difference going from 0 to 1 child, or 2 to 3 children, or 3 to 4 children, especially if we expect the housing costs to be an impediment to having kids. That might be for people who already have higher parity, 2 kids, and if they could afford a house, they'd have that 3rd kid. We don't really know that from these analyses because it's only focused on first birth. Methodologically, I won't say much, but I thought it was very thorough and comprehensive, and I applaud Dr. Yang on using 2 different methods and comparing the results transparently between the 2 of those. And there's also variation factored in by race, education, metro, and all of that, which again, I think was really strong methodologically. My only 2 suggestions for the paper, the first one was that I wish I knew a little bit more about banking deregulation. Perhaps I'm naive, it's not my field, and it also happened when I was a kid, but I would have loved a little bit more, especially because 3 out of the 4 types of regulations ended up having no effect on fertility. But the paper is largely about bank deregulation, but 75% of the restrictions had no effect. And then there was this big effect for the statewide deposit cap at 30%. That one had an effect, but I was wanting to know more about why that specific bank regulation had an effect vis-a-vis the other 3, especially because they did not. And then making the link clear between that particular regulation and fertility, because most people making fertility decisions, of course, have probably never even heard of banking deregulation, or at least this particular restriction. At least, I know I had not. And then that's more of a minor suggestion, but my bigger suggestion was that I wish there was a little bit more in the paper about state variations and differences between states. The paper is presented in that we have this exogenous shock to policy in 1996, let's say, and some states deregulate, some states do not. But it's only sort of a natural experiment to the extent that these states were similar beforehand and would have followed similar trajectories in the absence of this exogenous shock. But I'm not totally sure that's the case. And I was looking at table 1, which is a beautiful table. It shows all the states that deregulated and the year that they deregulated. Now, 1996 is our focal year. And just out of curiosity, I put up the electoral map of these states in 1996. I was just a kid, but that was a presidential election between Bill Clinton and Bob Dole. And I just marked off which states were won by the Democratic candidate, Bill Clinton, and which states were won by the Republican candidate, Bob Dole. And in 1996, 8 out of the 11 went to the Democratic candidate, including California and Pennsylvania. In 1997, 8 out of 10, including New Jersey, Massachusetts, Wisconsin, and Washington. 98, it was 9 out of 13. In 2000, it was 1 out of 1. And these are all including some of the most populous states in the country. So 26 out of 35, 75% of those states in 1996, which is this pivotal year, voted a certain way, which suggests to me there's some sort of geopolitical qualities or characteristics of these treated states that are different than the untreated states. And if there are differences or important differences at the state level, then our treatment and untreated groups have other differences that might be confounding the results. And so that was my one sort of wish for the paper. It was very persuasive. I bought all the arguments, but I was just wondering if the state level variation could be explored more, and if maybe those states were already on a different fertility trajectory, that would have shown decreases in trajectory regardless of the banking deregulation policy, and they very well may have. I think I will wrap it up here. I will just acknowledge, I know that Dr. Yang did do a test of the results with California and Texas removed, but since so many of the states were similar, I think just removing California and Texas might not quite answer the question about if certain states are driving these results. I would suggest maybe doing an analysis where you can incorporate more state level time varying covariates, or looking at how certain states voted in 1996 and maybe doing the analysis among states that voted similarly or had similar geopolitical context. But overall, very impressive. I really enjoyed reading this and I learned a lot. So thank you very much, Dr. Yang.
Thank you, George. Now we have an encore from Brittany, who will discuss the 3rd paper. So I'll give it over to her.
Thank you, Basu. As Basu just mentioned, I had the pleasure of not only reading Patrick's paper, but also reading Kristen and her co-authors as well, and had the opportunity to provide a little bit of feedback or just some comments. So as Kristen mentioned, not too long ago, Her and her co-authors' research is aimed at better understanding the financial aspects of shared households as a safety net for adults aged 65 plus. In this research, Kristen and her co-authors are first interested in the type of household adults 65 plus live in, whether they live alone, live with a romantic partner, or with a family member or non-family member, such as a friend or roommate. However, the main focus is really on those shared households, or at least from my perspective, looking at whether the adults 65 plus were the host, i.e. the homeowner, or if they were the guest, not the homeowner, to better understand if and how they are contributing to the cost associated with the house, such as the rent or mortgage, as well as utility payments. With the growing population of adults over the age of 65 plus, I found this work to be incredibly interesting and informative, and very much in line with some of the topics that researchers, especially gerontologists, are interested in better understanding. What I took away as the main finding was that guests are likely to not contribute to housing expenses, but when they do, it's far less than their host counterparts. I think colloquially, if I'm pronouncing that word correctly, it fits very much in line with my understanding of potential family dynamics and financial obligations and or expectations that might be associated with moving into somebody's home or somebody moving into your home. And so it got me thinking about why individuals might move into somebody's home or vice versa, especially among this 65 plus population. And with that, I think there is some room for Kristen and her co-authors to bolster their framing of their research. And I've thought of a couple covariates that I think they might want to consider as they continue to develop this paper. For example, health changes. So currently, this paper includes a binary measure of disability status. However, given the population of interest, I think it might be worth considering or at least testing alternate ways of accounting for disability, such as a count measure. Yes, having a disability could be very informative, but not necessarily reason enough to move in with another person or for somebody else to move in with you. However, once you start getting 2 or 3 or 4 disabilities, that might be a little bit of a different story because it might be interfering with their ability to live a happy and functional life. And so I think not only could a count measure of disability kind of get at their ability to care for themselves, but there's, as Kristen mentioned, also financial implications for disability, and having more disability is likely associated with higher financial costs as well. And so their ability to contribute to the household or household costs might be impacted by that. And in this vein, please correct me if I'm wrong, but health status is not currently being considered. We know that while related, health and disability are capturing similar things, they are a little bit different. And so I think that including a measure of health, it's a pretty simple measure of great health, good health down to poor health, could be something that you might want to look into when you are, again, moving forward with this paper. Kristen and her co-authors mention how there are well-known documented differences in who owns a home and then who rents a home. And while this is in the beginning of the paper, I think it might be interesting to take a little bit more time and look at those differences. So kind of split apart the sample if the sample lends itself to that. So seeing if the amount that individuals contribute or whether or not they contribute is dependent upon if the home is owned or rented. And again, maybe even seeing this among hosts as well as among guests. And then another variable that I think might be helpful in fully understanding this story is including a measure of household income. I can imagine a scenario in which an adult 65 plus might move in with a child who is perhaps making ends meet, but is not necessarily well off. And so the older adult may feel obligated or even asked to contribute to household expenses. Whereas if they were to move in with a wealthy sibling or wealthy other family member or even friend, they may be offering to contribute, but might be told they don't need to. And if you are to consider household income, I would also recommend considering household size, as that might be another important factor to consider. And then future things that you might want to consider, not necessarily within this paper, but if you were to move into a longitudinal paper or even perhaps a sister paper, in thinking about older adults, kind of what we know about them, what's happening in their lives, I can't help but think about some of the marital status changes that they are experiencing. So currently in your non-shared household individuals, you include those who are living alone and those who are living with a romantic partner. I think it might be interesting in seeing how those, if you split up those two groups, how they are a little bit different. So not only is this age group likely to experience spousal loss than their younger age group members, but there's also been a well-documented rise of divorce among the 50+ population, also known as the Great Divorce. And both of these changes to marital status have the potential to impact their household status, i.e. they are moving out of one home into another, even if it is moving alone, or they could be moving into another family member. So that's associated with housing costs right up front. There's also financial implications of getting divorced or losing a spouse. And so I think that could be really interesting. And in regards to looking at it longitudinally, in the 2021 SIPP and in 2022, we will continue on, we include some more detailed marital history information. And so you are able to more so pinpoint when divorce or widowhood happened. So you can kind of help capture a timing aspect if you are interested in really seeing how shocks to your marital status could influence not only where you're living, but how much you're able to contribute to the household costs. And then building on that, just a little bit, as there's been a rise of lat relationships or relationships where people are living apart but together, while not necessarily uncommon among young adults, research has found that older women in particular might not want to live with their partner, especially if they partner up in later life or when they are a little bit older. Reasons for this could be not wanting to be a caregiver, especially if they've been one before, or not wanting to blur any lines with finances, but not wanting to move in with somebody versus not being able to financially live alone are very different. And so I'm not sure exactly how you would be able to kind of parse apart this relationship, but this could be important framing in terms of just setting up your paper and thinking about why these individuals are living with who they're living with. But overall, I am a huge fan of this paper. I love research on older adults, and I really look forward to seeing the future version published. Please let me know if you have any questions about anything I shared, and I look forward to hearing you talk about it more. Thank you so much for the opportunity to read it.
Great. Thank you for our discussions. Now we'll have Q&A. First, I'd like to give opportunity for presenters to respond to some of the comments from discussants.
I'll go ahead. Brittany, thank you so much for your comments and your really careful read of the paper and your very thoughtful suggestions. Your assumptions about the paper are exactly right, and that you've gotten everything right that we did and didn't include. And so I really appreciate these ideas on the health status and on the relationship status. And you've given us a lot to think about as we get back to work on it soon. So thank you again.
Thank you again for letting me read it. I appreciate it.
Should I go? Okay. So I want to thank George for such thoughtful and great comments about my paper, and particularly about summarizing the theory part that I didn't get the chance to talk about during the presentation, and about some of the comments that particular about why the other three deregulation doesn't work. Well, the one I'm talking about here, so that's a really good question. That's something that I have been confused. Actually, I don't have a really good answer for that, but I have been, talking to some people in doing finance, and we were thinking about doing another project specifically about to figure out, different deregulations and why some have a large impact while the other do not. But we do have some preliminary results in the regard that all the other deregulations, they happened relatively later compared with the one that I talk about in today's presentation. So that might be the explanation, but I'm not, at this point, I'm not 100% sure, but I agree with you. I think this is something that maybe worth explore a little bit more. And I'm also curious to know why this particular deregulation matters more compared with the other. So hopefully I will have, better answer after we have another paper. And also, thank you very much for brought up the geopolitical difference in terms of those different states. I could definitely, I haven't thought too much about it, but this is definitely something I can include in the paper and to check what's the difference compare the deregulated states and those who did not go through the deregulation. And about the first children, yeah, I agree with you. I would like to also look at the other children. The reason I put up the first birth here is I want to also look at the timing of a fertility instead of just the number, the quantity. So there's a different, measurement here. So I think the first birth could add some information in terms of the timing of the fertility. But at this stage, I haven't, maybe in the paper, I haven't been clear about this part yet. You have also mentioned why only use the 1990 age and the ownership status as my subsample analysis. I think the reason I'm trying to do this is because I want to keep my the control group and the treatment group to be comparable at the beginning of my sample period. So the idea is, at the beginning, before all the treatment has happened, I want them to be kind of comparable. But I could definitely think about, bringing the variation, for the later years. And thank you again for the great comments.
Thank you as well.
Great. Go ahead.
I'll just note that I appreciate Brittany's feedback. I agree with all the areas or directions for future research she identified. Probably the one that would have the greatest congressional interest would be further exploring the reasons why some non-resident parents are not working. I've done other work on existing employment programs for non-resident parents, and so there's a lot of interest in the policymaking space around how to encourage more non-resident parent employment with the potential side effect being producing more child support payments for custodial families.
Great, thank you. So I'll go through some comments in the chat. Also, again, open it up for the audience. So Holly comments regarding Brittany. SIPP includes reason for move to residence, and the variable is EHC _Y. I believe that, yeah, go ahead. Kristen, go ahead.
I was just gonna say thanks for giving me the variable name for that.
Yeah. That makes things much easier. Yeah, I'll open up for the audience if they want to vocally present their question. Just raise your hand, that little raise your hand button. Okay. Well, just to encourage discussion, I was looking through each of the papers and just had some general questions. So for Patrick, in terms of discussing the report, was there any comparison or just looking at works from the Fragile Families Childhood Wellbeing Study? I know the name changed at this time, but just curious if, even taking a peek at that and seeing how your findings compare.
So that is a data source that we're definitely familiar with at the Census Bureau, and I believe underlies probably a number of the more academic papers cited in the report's footnotes. It isn't a data source that we immediately turn to because it is such a specialized sample. Plus, it's starting much earlier than the present. And so, often the first thing we're doing with data analysis at the CRS is just trying to get an accurate description of the broadest population possible, and only then maybe turning to, we have more specialized questions where a data source like Fragile Families or newly renamed would be more helpful for answering that specific question. So I have not personally dug into that data source other than being familiar with a lot of the research based on that survey.
Yeah, that's good to know. I was just curious about that. And then for terms of G's paper, I was just trying to see if you thought about using the 2008 panel. I know probably it's you're ready to submit it, but just curious about seeing what the Great Recession or things like that might have, how those can play a part.
Yeah, definitely. So originally I have included the 2008, and the reason I want to exclude it is because I don't want the recession to interfere with my results, but I think it's actually a good idea to look at what is those impact during recession, but maybe in a separate paper. So yeah, definitely that's something I would love to look at next.
Yeah, that makes sense. I think, yeah, it would just focusing or narrowing the scope is very helpful. And I know there's a whole discussion. I don't know if a referee is gonna bring it up, but on the clustering level, and you did it at the treatment, the standard errors, and I'm just curious if you've explored if there is a question regarding
Yeah, I have tried.
cluster
So
sizes and so forth. Yeah.
yeah, so I have tried at the state level, and for the aggregate fertility rate, I have tried the county level. I think the results are consistent, but I don't think I have tried the SIPP with the individual level. That might be something I can try to see whether the results are robust. But I have seen some like a discussion about, if we are doing this difference in difference treatment, like which level you should class at. And I feel like I'm not sure, like exactly sure which way to do, but I feel like the recommended way is to cluster at the treated level to make sure you considered the correlation within the treated. So that's why for now, that's what I have done. Yeah, but thank you for this comment.
Sure. I'll send, I know you're familiar with the McKinnon paper and company paper that talks about comparing cluster sizes before and thinking carefully about the clustering of standard errors. So maybe I could send that if you don't.
Yeah, that'd be great. Thank you.
Yeah, and for the third paper, I was curious on the thinking about mobility or migration in the face of like changing cost of living, or how that plays a factor. I know you're using the more recent SIPs where we have a very high inflation rate and some cities are getting really expensive. So I'm just curious about if you're thinking about expanding into that or just discussing that, or just, yeah, what's your take?
Yeah, so we haven't yet talked about any kind of geographic variation or variation by metro or non-metro status. But I think it's something that we're certainly going to hope to integrate when we move into a more longitudinal look is moving both, you know, the changing household composition, but also a focal older adult making a move. And so certainly that'll be relevant. And we do have panels up through the 2021 panel, so we're using data through, you know, calendar year 2020.
Yeah, and I think also related is you could see household formation or changes across time for the household. So that might be nice to look at, and you might have depth or add further depth to your paper. So, but it was interesting to read. So thank you.
Well, certainly the longitudinal household composition is what drew us to the SIPP in the first place. So we're definitely looking forward to taking advantage of that.
All right, we have about 4 minutes. Let me just check. Are there any questions from the audience? Oh, yeah, go ahead.
So I actually have a more like a general question, since we were talking about the household composition here. So I wondered, whether some of you guys have checked the variable, which is the number of children. And I was wondering, like, because sometimes I have checked the number of children, like if the SIPP say we have 3 children in this household, but when I then look at, you know, the detailed information of children, maybe we only have 1 children or 2 children in this household. So I was just wondering how this number of children was determined. You know, what does it meaning like the children who are currently living in the household, or they also including some other types of children? Yeah, thank you.
I think someone who's worked with the variables can discuss this.
I can maybe speak to this a little bit. I would like to caveat that I am not necessarily the most familiar with the years of SIPP that you are personally working with on your paper. But SIPP does collect, especially in recent years, the total number of children ever birthed or fathered. So that just means all biological children. We have the number of all of those children. And then in recent years of SIPP, we also include information upon year of birth. So you can calculate the years of birth as well. We have a parent screener that indicates whether you are a step parent, an adopted parent, or a biological parent. And so that helps to calculate what is missing from just the total number of children, because that total number of children does not get it adopted or step. And then we do have the variable that Patrick had as his focal variable, being the number of children under the age of 21 who are not currently living at your residence. So we kind of have a variety of different variables, especially in regards to fertility, that you can use. Again, I'm not 100% sure. I believe there is a fertility module that you might be able to use with the data that you're interested in, but I would have to double check that. If anybody in the room is a little bit more familiar, please speak up and correct me if I misspoke. But Dr. Shi, we can also be in contact if I can help you further identify some of the variables that you were interested in.
Yes, thank you very much.
Yeah, thank you, Brittany. One question that came up for Patrick. Could you explain why you only focus on white and Black parents and don't include other race or ethnic groups from URIS?
Sure. So in the full report online, I present the following racial ethnic combination groups. So white non-Hispanic, Black non-Hispanic, Hispanic, and other. And so that level of detail was really driven by the sample size of the SIP in terms of what kind of detailed breakdown results in reliable, large enough samples when I'm also splitting by, just looking at non-resident parents or just looking at low-income non-resident parents. And so all those groups are looked at. And the reason why in the slides, I was typically just presenting the results for non-Hispanic Black was because that was the group that kind of had the greatest variation in the group of interest, say non-resident parents versus resident-only parents. So there were a disproportionate share of non-Hispanic Blacks, non-resident parents. And typically, depending on the comparison, that overrepresentation of non-Hispanic Black parents was driven by, say, smaller shares of non-Hispanic white or other parents with a lot of other parents being driven by, for instance, parents who report Asian descent. So hopefully that answers your question. That I look at the presentations that are readily available using the SIP measures in the full report.
Thank you. I know we're at time, but there's an additional question for Kristen. So
Sure. I took a look.
Yeah.
Thanks, Iris, for your question and for your comment in the listening session before about my variable question. But we did look at the household type distribution across time, and there weren't big changes in the proportion of older adults in those different categories by panel. But we haven't run the models stratified by year or including a year. So that's something that we are going to look at in the future. And yeah, certainly thinking through the reference year, that 2021 panel with the data from 2020, we'll have to keep an eye on that.
Great. Thank you. I know we're on time, so great presentations. It's very interesting discussion. And now I guess we'll close it off. And thank you all for coming. I know it's the end of the day, so thanks.